So, hello everyone. Today I'm going to start. The topic is arterial blood gas analysis. We can also call it as a ABG analysis. Islamically, ABG, arterial blood gas analysis. So today's outline of the topic is, so we'll talk about the introduction of ABG, then definition, indications, ABG components, the normal value, procedures, preparatory performance and follow-up phase, complications, acid-base disorders, result interpretation, and compensation mechanism. And then at the end of the topic, we'll have problem-based questions in the tutorial sections. Coming to the introduction, just see here the major functions of pulmonary system, that means lungs and pulmonary circulation, is to deliver oxygen to the cells, and they're going to remove the carbon dioxide from the cells because there is no use of carbon dioxide, so that is going to expel out from the body. If the patient history and physical examination reveal the evidence of respiratory dysfunctions, the diagnostic test will help identify and evaluate the dysfunctions. So what is the alteration is there? For the sake of that, we are going to perform ABG analysis. So it is one of the first tests which is going to be ordered to assess the respiratory status, because it helps to evaluate gas exchange in the lungs. So ABG test can measure how well the person's lungs and kidney are working. So we are going to find out the status of the lungs and kidney, whether they are working properly or not, and how well the body is using energy through the metabolic processes. So coming to the definition of ABG test, it is nothing but the diagnostic procedure in which a blood is obtained from an artery directly by an arterial puncture. So through the arterial puncture, we are getting blood, and which is assessed by way of indwelling arterial catheter. So this is the way we are going to uh, draw the arterial blood for the ABG analysis. So what are the indications? So indications to obtain information about patient ventilation, that is PaCO₂, and in the case of oxygenation, PO2 and acid base parameters, and monitor gas exchange and acid base alterations for patient on mechanical ventilator or not. Another indication is to evaluate response to clinical intervention and diagnostic evaluation. So that is nothing but the oxygen therapy. And ABG test may be most useful when a person's breathing rate is increased. If the person is hyperventilated, or the person is hypoventilated, or when the person has very high blood sugar levels, in the case of uncontrolled diabetes mellitus, or severe infections, or heart failure. So that is the indications. So what are the components of ABG? In ABG, first and most important component is pH. So pH means measures hydrogen ion concentration in the body. It shows blood, whether blood is acidity or alkalinity. So we are going to find out whether blood is acidic or alkaline with the help of the measurement of hydrogen ion concentration inside the blood. So that is nothing but the pH. So another one is partial pressure of carbon dioxide, PaCO₂. So it is the partial pressure of carbon dioxide that is carried by the blood for excretion by the lungs. That means the blood which carries the gases, respiratory gases, for the excretion with the help of lungs. So that is known as respiratory parameters. Another one is PO2, partial pressure of oxygen, that is dissolved in the blood. It reflects the body ability to pick up oxygen from the lungs. That means the value of PO2 reflects the how much ability of body to pick up the oxygen from the lungs. That's what we are going to measure the PO2. So it will give us information to ability of the oxygen grabbing from the lungs. So another one is important parameters, bicarbonate. So this is the metabolic parameter. Keep in your mind, if respiratory parameter means you must know partial pressure of carbon dioxide. If there is a metabolic parameter, you must know bicarbonate. So bicarbonate is called as metabolic parameter. What does it mean? It reflects the kidney's ability to retain the and excrete bicarbonate. When I was talking about the partial pressure of oxygen, so it reflects the ability of lungs, whereas bicarbonate, it reflects the ability of kidney. That's what metabolic parameter. So how much ability of kidney to retain and excrete that particular bicarbonate. So these four parameters are important components of ABG, arterial blood gas analysis. So coming to the normal value, you must know the normal value. If you know, you can easily find out the clinical aspect. So pH, as you all know, the pH is 7.35 to 7.45, and partial pressure of carbon dioxide, that is 35 to 45 mmHg, and partial pressure of oxygen, that is 80 to 100 mmHg, whereas bicarbonate, the value of bicarbonate is 22 to 28 milli equivalent per liter. Once again, I am going to repeat the value. You must know and you have to buy out this value. So pH is 7.35 to 7.45, whereas partial pressure of carbon dioxide is 35 to 45 mmHg, whereas partial pressure of oxygen is 80 to 100 mmHg, whereas bicarbonate value is 28 to 20, so 22 to 28 milli equivalent per liter. You must know all these value. So this is the normal range, normal value of ABG parameter. So coming to the equipments, we need in our those kit for the ABG that contains 1 ml of syringe, 23 to 26 gauge of needle. You must remember the gauge of needle is 23 to 26, and they contain stopper, alcohol swab, disposable gloves, plastic bag, and crushed ice. This is the optional one. And heparinase vial, that is 1:1,000. Ratio of the anticoagulant is 1:1,000, whereas barcode, not a barcode or level, so all these are requirements. So coming to the preparatory phase, so record patient inspired oxygen concentration. And another point is you have to check the patient temperature, and we must explain the procedure of ABG to the patient because it is quite painful procedure. That's what. And provide privacy for client. So we have to maintain privacy of the patient because we have to follow the code of conduct for the professional ethics. So we have to maintain the professional ethics. So the privacy should be maintained. If not using heparinized syringe, heparinized needle must use. If we are not going to use the heparinized syringe, then we must use heparinized needle. So as you all know, heparin is the natural anticoagulant. Perform Allen's test. I'll explain in another slide. And that is Allen test. So we have to perform Allen test. Wait at least 20 minutes before drawing the blood for ABG. After initiating, changing, or discontinuing oxygen therapy for setting of mechanical ventilation, after suctioning the patient or after extubation. So you have to remember in preparatory phase. So coming to the Allen's test, what do it mean? In Allen test, so it is the test which is done to determine that collateral circulation is present from the ulnar artery in case of thrombosis occurs in the radial. So this is the way, like a physical examinations, you can find out is there any uh, proper circulation is there or not, due or other. If the proper circulation is not there, that means there must be a thrombosis, so it will affect the value of ABG. That's what we are going to perform Allen's test. So it is most commonly done in the radial artery or ulnar artery. So site for the obtaining ABG, first and most common site. If you're getting MCQs questions, you have to click on the radial artery. Radial artery is the most common site for the ABG. Another one is brachial artery, optional. Femoral artery is optional. So radial artery is the most preferable site used because it is easy to assess. It is not a deep artery. So patient may get quite less painful. So which facilitate palpation. You can easily palpate. Stabilization and puncturing is quite easy than other artery. So the artery has a collateral blood circulations. You can see here. So performance phase. First, we have to wash our hands, put on gloves, palpate the artery for maximum pulsation. If radial, if the choice is radial artery, you have to perform Allen's test. Place a small towel roll under the patient wrist. It will support while the collecting blood. Instruct the patient to breathe normally during the test because So artery quite deeper. So when you will puncture the artery through the needle, it will be painful situation. So we have to instruct the patient. So instruct the patient to breathe normally during the test and warn him that he may feel brief cramping or throbbing pain at the puncture site. We have to inform before starting the procedure. Clean with alcohol swab in circular motion. This is the way to clean the puncture site before the puncture. And skin and subcutaneous tissue may be infiltrated with local anesthetic agent if needed. If the patient is quite getting pain, before that we have to, if patient is worried, we have to use local anesthetic agent with the consultation of anesthesiologist. Otherwise, if patient they don't need, there is no need. If patient get worried, if patient is quite feeling painful. So I was talking about the performance phase. After that, insert the needle at 45 angle. So if you are going to choose the radial artery, we have to insert the needle at 45 degree. If the brachial artery, it should be 60 degree. If the femoral artery, it is 90 degree. Withdraw the needle and apply digital pressure. Check bubbles in syringe. Place the cap syringe in the container of ice immediately. Maintain perform pressure. Once you collect it, so place the capped syringe in the container of ice immediately. Afterwards, maintain firm pressure on the puncture side. Those side you insert the needle and a syringe and got the sample. So that side you have to maintain the firm pressure continuous for the 5 minutes. If the patient has coagulation alterations, if patient have coagulation abnormalities or alterations, so apply pressure at least for 10 to 15 minutes. Why? Because the individual may have long clotting time. So the pressure, we have to form the pressure, maintain the pressure about 10 to 15 minutes. So follow-up phase, send labeled ice specimen to the lab as soon as possible. Palpate the pulse distal to the puncture site. Assess for cold hand, numbness, tingling, or discoloration. If there is anything, just observe and ask the patient if anything alteration is there or the discoloration is there. Documentation includes, you have to maintain the documents, results of Allen test, what you got after performing the Allen's test, just keep in record. Time the sample was drawn, in which time you drawn the sample, just maintain on record. And just keep the temperature also. What about the temperature of the patient during the procedure? And which puncture site you choose? That means which artery you choose for the collection. And the time pressure was applied in. So how much time taken for the pressure when you applied after the collection, form pressure. If oxygen therapy is there, if the patient is in oxygen therapy, just keep in record. Make sure it is noted on the slip whether the patient is breathing room air or oxygen. Just keep in slip in record. If oxygen, document the number of liters. If the patient is taking oxygen, so how much liter Just keep in record. If the patient is receiving mechanical ventilation, FiO2 should be documented. So you have to mention in the record file. So coming to the complications, after completion the procedure, you may get simple complications. We have to manage. We have to. So that is the first one is arteriospasm, temporary hematoma, hemorrhage, distal ischemia, infection, numbness. So all these are complications after the collection of sample. So as I already discussed about the acid base, so the body constantly works to maintain a balance that is called homeostasis between the acid and bases. As I already talked about the acid base balance. So without the balance, cells cannot function properly. So in our body, acid base homeostasis or regulation is too much important. Why? Because without that, cells cannot function properly. As cells use nutrient to produce the energy, to buy product are going to form. So one is hydrogen ion concentration, another is carbon dioxide. So acid base balance depends on the regulation of the free hydrogen ion concentration. So there is the mechanism, as I already told you, there are three mechanisms for the regulations of acid base balance. So one is blood buffer mechanism, another one is respiratory mechanism by the lungs. So third one is renal mechanism by the kidney. Even slight imbalance can affect metabolism and essential body's functions. Slight imbalance that much can affect. So several conditions as an infection or trauma and medications can affect acid base balance. So coming to the interpretation of ABG results, if the pH is 7.4, so it is acidemia. If the partial pressure of carbon dioxide 55 mmHg, so the pressure is partial pressure of carbon dioxide is increased. So that is nothing but the respiratory cause, as I already mentioned in previous slide. So that is respiratory cause. If the bicarbonate value is 25 milli equivalent per liter, so that is the here is normal. If the partial pressure of oxygen is 80 mmHg, that is normal. So normal range of partial pressure of oxygen is how much? 80 to 100 mmHg. And bicarbonate is, what is the normal range of bicarbonate? Is already informed you. Hello, any one of you? What is the normal range of bicarbonate?
28 milliequivalent per liter.
22 to 28.
22 take it 28.
What about the
MEQ
partial pressure of carbon dioxide?
35 to 45 mmHg.
Okay, good. So this is the respiratory cause. So respiratory and the pH is acidic. So acidemia, that means respiratory acidosis. Another one is pH is 7.49. That means pH is alkaline. Partial pressure of carbon dioxide 40 mmHg. So this is the normal. Bicarbonate 29 millicalorie per liter. The normal range How much is the normal range? 22 to 28. So it is quite increased. If the bicarbonate is increased, that is the metabolic cause, as I already told you. So what is the condition here? Metabolic, here partial pressure oxygen is normal, so metabolic alkalosis. Coming to the acid base disorder, just see here, just a minute. Just see here, coming to the acid base disorders in quite easy way. If the respiratory acidosis, so respiratory acidosis means pH is acidic and partial pressure of carbon dioxide is going to increase. If the alteration of partial pressure of carbon dioxide, that means the cause is respiratory cause. Okay, so pH and pH and partial pressure of carbon dioxide in opposite direction, whereas bicarbonate there is nothing change. So bicarbonate is normal. So that means the condition is respiratory acidosis. If the respiratory alkalosis, pH is going to increase, partial pressure of carbon dioxide is going to decrease, whereas bicarbonate is normal. So that is both are in opposite direction. So that is pH is increased, that means alkalosis, and the cause is partial pressure of carbon dioxide change means the respiratory cause. So respiratory alkalosis. Coming to the metabolic acidosis, metabolic means the alteration is in bicarbonate, whether it is increased or decreased. If the pH is decreased, so that is acidic. So what happened? Metabolic acidosis means pH is going to decrease, bicarbonate is going to decrease, partial pressure of carbon dioxide is normal. So pH and bicarbonate is in same direction. That is metabolic acidosis. If I'll talk about the metabolic alkalosis, pH is in uptrend, bicarbonate is also uptrend in same direction, whereas partial pressure of carbon dioxide is normal. So pH increase means alkalosis, metabolic cause. So metabolic alkalosis. So coming to the compensatory mechanism, during the compensation, the respiratory and metabolic system works together to keep the body's acid-base balance within normal limits. That means respiratory and metabolic system, that means lungs and kidney play an important role to maintain the acid-base balance within the normal range. The respiratory system responds to metabolic-based pH imbalance. If the respiratory system is going to respond to the metabolic-based pH imbalance in the following manner, that means if the metabolic acidosis increased respiratory rate and depth, that means decrease partial pressure of carbon dioxide. Metabolic alkalosis, decrease respiratory rate and depth, increase partial pressure of carbon dioxide. The metabolic system respond to respiratory based pH imbalance. That means if the metabolic system alteration is there, so it responds to the respiratory system, that means lungs. Okay, so what happened? Respiratory acidosis, bicarbonate reabsorption is going to increase. If the respiratory alkalosis, bicarbonate reabsorption is going to decrease. So coming to the respiratory acidosis, so respiratory acidosis, just see here, You can please, this is the important slide. Just see here. If the uncompensated phase, the pH is decreased, partial pressure of carbon dioxide is increased, bicarbonate is normal during the respiratory acidosis. So what happened? Because there is no response from the kidneys to acidosis, the bicarbonate will remain normal. So there is no response from the kidney. So what happened? In partial compensation mechanism, pH is in downtrend. Partial pressure carbon dioxide is in uptrend. In partial compensation, what happened? Bicarbonate is going to increase because acidic means we have to increase the alkalinity. So what happened? Bicarbonate level is going to increase during what? Partial compensated. So the kidney starts to respond to the acidosis by increasing the amount of circulating bicarbonate in the blood. That means before compensation, the kidney is not going to respond. Once compensation mechanism starts, kidney is going to respond by increasing the amount of circulating bicarbonate. So what happens? Once the fully compensated mechanism occurs, then what happens? pH comes under the normal and partial pressure of carbon dioxide still increased and bicarbonate is still increased. So what happens? pH return to the normal, partial pressure of carbon dioxide and bicarbonate levels are still high to correct acidosis. So this is the compensatory mechanism during respiratory acidosis. Okay, coming to the another one, respiratory alkalosis. So during uncompensated mechanism, so what happens? Alkalosis means increased pH. Cause is the partial pressure of carbon dioxide. So there is a decreased partial pressure of carbon dioxide. Nothing change in the bicarbonate. So this is the uncompensated mechanism. Once the compensation starts, so what happens? Before starting the compensation mechanism, because there is no response from the kidneys to acidosis, the bicarbonate will remain normal. Still there is normal. Once the compensation started, what happened? pH still increased, partial pressure carbonate still decreased. So bicarbonate level is going to decrease. So what happened? The kidney start to respond to the alkalosis by decreasing the amount of circulating bicarbonate, because there is already bicarbonate is there. So pH is increased there. We have to remove the bicarbonate. So the kidney is going to respond and bicarbonate level is going to decrease, circulating bicarbonate. So once full compensation occurs, then what happens? The pH comes the normal range and partial pressure of carbon dioxide and bicarbonate is still in decreasing phase. What happens? So pH returns to the normal, partial pressure of carbon dioxide and bicarbonate levels are still low to correct alkalosis. So this is the mechanism which occurs during the respiratory alkalosis. So this is the mechanism, how our body is going to respond for the compensation mechanism. Okay. So another one is metabolic acidosis. So in metabolic acidosis, during the uncompensated phase, so what happens? pH, acidosis means decreased pH, decreased bicarbonate is there in same way, same direction in metabolic acidosis, but there is nothing change in the partial pressure of carbon dioxide. As I already told you, if the alteration is bicarbonate, that is the metabolic cause. If the pH increase, acidosis, sorry, alkalosis. If pH decrease, acidosis. So what happened during the uncompensated mechanism? because there is no response from the lungs. To acidosis, the partial pressure of carbon dioxide will remain normal. So once compensatory mechanism started, so what happened? Still the pH and partial pressure of carbon, pH and bicarbonate is in the same direction. So what happened? Partial pressure of carbon dioxide is also going to decrease in the same direction of along with the pH and bicarbonate. So the lungs start to respond to the acidosis by decreasing the amount of circulating partial pressure of carbon dioxide. So the lungs, which play an important role during the alterations in metabolic acidosis, once the compensatory mechanism started. So what happened? Once full compensated mechanism accomplished, then what happened? pH comes within the normal range, and partial pressure of carbon dioxide and bicarbonate is downtrend still. So pH returns to the normal. Partial pressure of carbon dioxide and bicarbonate levels are still low to correct the full acidosis during metabolic acidosis. So this is the mechanism of compensatory mechanism during the metabolic acidosis. So the last one is metabolic alkalosis. So in metabolic alkalosis, what happened? In uncompensated mechanism, pH in bicarbonate is upward trend. So there is an increased pH. Alkalosis means increased pH, and same direction bicarbonate level is going to occur. So what happened? Increased pH and bicarbonate. So what happened? Partial pressure of carbon dioxide. Partial pressure of carbon dioxide is normal because there is no response from the lungs. Add to alkalosis, the partial pressure of carbon dioxide will remain normal. Once compensatory mechanism started, so what happened? Along with the pH and bicarbonate, partial pressure of carbon dioxide is also uptrend. So what happened? That means lungs is responding. So lungs started to respond to alkalosis by increasing the partial pressure of carbon dioxide in the circulation. So once full compensatory mechanism occurs, then what happened? pH comes within the normal range, and still the bicarbonate and the partial pressure of carbon dioxide in uptrend. So pH return to the normal. Partial pressure of carbon dioxide and bicarbonate levels are still high to correct the alkalosis. So these are applied aspect. These are the three conditions. Once the regulations of blood pH is altered, so what happened? There is a alkalosis, or it must be a acidosis. If the alkalosis is there, it may be cause respiratory cause or metabolic cause. In same acidosis, it may be all respiratory or metabolic cause. So what happens? If I'll talk about the respiratory acidosis, okay, respiratory acidosis, so there is a increased partial pressure of carbon dioxide and decreased pH. So what are the conditions here? What are the clinical conditions, causes? It may be a chronic pulmonary diseases. So due to asthma, chronic bronchitis, pneumonia, pulmonary thromboembolism, or it may be a emphysema. So what happened? Due to the cerebral diseases, there is a multiple sclerosis and poliomyelitis, respiratory muscles weakness. So all these are causes of respiratory acidosis. If I'll talk about the causes of respiratory alkalosis, so that means the lack of carb oxygen tension in the tissue level.
केना एक मास सुतल छलियै हम तऽ कुछ नहि भेल छलै आ सुनते सुनते मात्र भैंसी जी का सब अथी कऽ देलकै
That means hypoxia. It is due to pneumonia, asthma, high altitude, carbon monoxide poisoning, hepatic cirrhosis, brain trauma, brain infections. These are the causes of respiratory alkalosis. Whereas if I'll talk about the causes of metabolic acidosis, that means due to the increased production of fixed acids like uncontrolled diabetic ketoacidosis, lactic acidosis, that means overproduction of lactate during anaerobic glycolysis, salicylate overdose, toxic substances ingestion like a methane and other substances, due to depletion of bicarbonate like diarrhea, carbonic anhydride inhibitors, renal failure, renal tubular, all these are causes of metabolic acidosis. If I'll talk about the causes of metabolic alkalosis, it may be a excess ingestion of sodium bicarbonate, it may be a excess loss of HCl due to vomiting, excess production of adrenal cortical hormones during the Cushing syndrome, hypokalemia, and all these are causes of metabolic acidosis. So this is all about the applied aspect of acid-base balance. Now I'm going to talk about the tutorial. So there is a problem-based questions you have to answer. So if you're able to answer properly, that means I can understand you must know the topic in better way. So coming to the example 1, just read the question. Jan Doe is a 45 years old female admitted to the nursing unit with a severe asthma attack. She has been experiencing increasing shortness of breath since admission 3 hours ago. Her arterial blood gas analysis results as follow. The clinical diagnostic laboratory report, the pH value is 7.22. Partial pressure of carbon dioxide is 55. Bicarbonate is 25. So what is the cause? First, tell me, what is the cause? How could you identify? Through the value. Please don't waste time. Let me know. Fast. Any one of you?
respiratory acidosis.
Okay, just see here. So how you find out? First step, assess the pH. So pH is decreased in manner. So it is nothing but the acidosis. So another one is assess the partial pressure of carbon dioxide. So it is uptrend. It is high and in the opposite direction of pH. So coming to the partial pressure of bicarbonate, the value of bicarbonate is 25. So this is the value within the normal range. It has remained within the normal range. So what happened? So this is the respiratory cause and acidosis. So what happened? As you already told, the respiratory acidosis. So each acidosis is present, decreased pH with the partial pressure of carbon dioxide being increased. So reflecting a primary respiratory problem. For this patient, we need to improve the ventilation status by providing oxygen therapy. The patient need oxygen therapy. Okay. So mechanical ventilation or by administrating by bronchodilators. So this is the treatment. So if you'll confine, what is the problem there? So it may help the patient to get a proper treatment. Otherwise, the patient may sacrifice their life. So that much important is. So coming to the another example, just go through this. John Doe is a 55 years old male admitted with a recurring bowel obstructions. He has been experiencing intractable vomiting for the last several hours. Here is his arterial blood gas result. So this is the clinical diagnostic laboratory report. So pH value is 7.50, whereas partial pressure of carbon dioxide is 42. The value of bicarbonate level is 33. So what is the problem here? Fast. Tell me fast. What is the problem here?
Alkalosis.
pH
Metabolic
increase.
acidic.
What is the problem?
Metabolic acidic.
So metabolic.
Alkalosis. No. Alkalosis.
Okay. So how
Metabolic
you find?
acid.
So first step, assess the blood pH. It is uptrend. That means the going to increase. As you all know, the normal range is 7.35 to 7.45. So therefore, alkalosis. So which alkalosis? Second one, the partial pressure of carbon dioxide. So this is the within the normal range. As you all know, 35 to 45 mmHg. So third one is bicarbonate level. So it is uptrend in same direction with the pH. As you all know, the normal range of bicarbonate 22 to 28 or 26, both are normal. So and moving in the same direction along with the pH. So it is in uptrend. Okay. So what happened? The cause is, what is the cause here? Metabolic cause. If the alteration is in bicarbonate, sorry, partial pressure of carbon dioxide, the respiratory. If the problem in bicarbonates to metabolic, so what happened? Alkalosis is present. That means increased pH with the bicarbonate level is increased. So reflecting a primary metabolic problem. Treatment of this patient might include administration of IV fluids and measures to reduce the excess base. So this is the treatment. So this report, if you are providing a quality of report to the patient, if you are uh, uh, doing a in proper manner, so clinician get confirmation from the report and they can treat the patient. They can once the patient will get a proper treatment, the patient may survive. Okay, so that much important is ABG. As you all know that this is the life-threatening conditions. So the ICU patient get check of all these parameters within a short interval of time. Okay, so you must know about the ABG analysis and its interpretation. Just keep in your mind, if the pH is alterations, if the pH is increased, so what happened? Alkalosis. If pH is decreased, that is acidosis. So once you confirm whether the acidosis or alkalosis by the normal, through the normal range of pH. If there is a problem in the partial pressure of carbon dioxide, whether it is increase or decrease, don't bother about that. That means that is the respiratory cause. If the alterations is the range of bicarbonate, whether it is increase or decrease, don't bother about that. That is the metabolic alterations. So if pH decrease and there is alterations in the bicarbonate, that is the metabolic acidosis. If the pH is uptrend and the alteration in bicarbonate, so what happened? Metabolic alkalosis. If the alteration in partial presence of carbon dioxide and pH is in downtrend, so what happens? Respiratory acidosis. If the pH is in uptrend and the alteration is in partial presence of carbon dioxide, so what happens? Respiratory alkalosis. So this is the theme point you have to remember. And this is the important questions you will get in your license examinations and your probative examinations and your Lok Seva examinations as well. So this is all about the respiratory, sorry, this is all about the ABG analysis. Okay.